Hey, what's up? It's Johnny King, and I'm so excited to have with me my buddy, Dr. Ruebbelke, here in his office.
This is it.
This is
1,200 square feet of beauty.
It's glorious. And we're shooting a little video here to chat more about all the things that we're passionate about, because he does some awesome work, and we'll talk a little bit more about that in terms of how he does soft tissue in his practice. But I also want to get into running his business and marketing and all things entrepreneurship. So thank you for joining me.
Awesome.
Thanks
Pumped
for
to
letting
do
me
it. Thanks for coming by.
Yeah.
You bet. This place looks amazing. We should get these lights installed.
Exactly. Do headshots before people come in. But that being said, I'd love to kind of start off with you kind of just telling your story of how you got into and explain through that what exactly is soft tissue. You're a chiropractor, but you're definitely not traditional chiropractic.
Definitely not.
Right?
Yep.
So share your story with kind of like where you started and sports and everything else.
Yeah. So I grew up small town, athlete, doing all the stuff that you do just to, there's nothing to do out in the sticks, so you just play sports. Mm-hmm. So played football growing up. My mother is a chiropractor. My grandmother was a chiropractor, so I kind of grew up with that mentality of, at least that lifestyle, that the body can heal itself if it's given the tools. It's got an innate ability to do so, but sometimes there's something, or there's some sort of issue that may not allow it to operate at full capacity or full function. So
totally believe that too. Yeah.
So all of my history with chiropractic and just with dealing with injury or dealing with anything was just based on what my mom thought I needed to do, which was like, oh, well, we can get you tuned up and we'll work on this and you should feel better. Or this is, those were things that were supposed to be a part of like vital health. So it kind of started from there. I definitely made a vow back in the day when I was really young to not do what she did for a living. It was like this, you're a young guy or a young person, you don't want to do what your parents do. It's like being almost like rebellious for no reason.
Right. You really strayed away.
Yeah,
pretty far.
You bet. Yeah, I said I want so little to do with this. I'm gonna go get the exact same degree as you, and
because to show that what you focus on is what you often get.
Yeah. So it's funny. So how that happened with chiropractic stuff was I actually didn't really know if I wanted to do that. I wanted to be a physical therapist. I wanted to be maybe a chiropractor, maybe a medical doctor, something. I just knew that I liked athletics and I liked the human form and the human body and what it could do. I was an athlete and I wanted to do something with that. Mm-hmm. But in college I studied some other stuff and then led me back to, all right, I still want to get into health in some capacity. So I actually had shadowed people that did these jobs. And I shadowed physical therapists, orthopedic surgeons, and chiropractors. And chiropractors that weren't my mom. And what I noticed was PTs were bored. And this is not necessarily a takeaway for everyone, but the people that I shadowed were bored. They were kind of like flicking through their phone, flicking through email while people were doing exercises, and they were just kind of going through the motions. They seemed unstimulated.
Uninspired, yeah.
And I was like, no, this is, I don't know, this seems very anticlimactic.
Yeah.
The orthopedic surgeons they seemed rushed. They seemed like they were just running around, and they seemed like they were dealing with people at their worst. Like these are high stress, like these are people that they need surgery, and or at least they think they do. And so that's why they're in your office, which means that they probably, whatever they have going on, has gotten really bad. Yeah. So you're not, you're seeing them with their life like drastically affected and all that stuff. But that still at least was interesting and was high level stuff. And then the chiropractor that I shadowed was just a very sociable person. And I know that you could be sociable in any line of work and potentially make that look cool, but he liked the work. He was stimulated. He seemed inspired. He thought he was doing like God's work. Like he was like it was very old school, but it was like, this is what we need to do to get you healthier. And these people were on board and they were pumped about it. They liked it.
That's cool.
And they had just this great energy And so I was like, well, it makes sense. I come from that background. It's all about health, preventive. The body has the ability to do this if given the right tools,
right,
without the drugs of surgery. Also the idea of like, oh, you can be a doctor and hopefully like you can do well for yourself. Like, all of those things seem to make a lot of sense.
right.
So I went for that. What helped was that I played rugby in undergraduate school and was good enough to make some teams that made me at least a candidate for scholarship money. And it just so happened that the chiropractic school I went to and that my mother and grandmother went to were scholarship.
Cool.
So I got paid to play, and then went and I got into it just basically through that. I mean, this weird funnel. The short story, it sounds like, oh, your mom was a chiro, so you became one. You went a different way. It was like, actually, no. It was like all these things that kind of led me back to it.
That's kind of cool.
Yeah.
Awesome. So tell us a little bit more about, well, I'll tell you real quick. You know the story, but people watching don't. I had been struggling just for maybe a decade with various things with my body. And I've gone to chiropractors in the past and gotten cracked, and it's always kind of, it's jarring. It's kind of like, people are scared to like have that crack in your neck. It's very vulnerable. And yet I never really felt like I got a whole lot of, relief from it. And so when I was here in town, we're in Denver, and I was just actually one morning doing push-ups in our warm-up, my whole neck had seized up, which is what we first started working on.
Yeah.
To the point where, and any times, probably for about 10 to 15 years, whenever I press heavy overhead, lifting in the gym, I could not turn my neck at all to the left, really. It all just seized up.
Yeah.
So this was the worst I've gotten when I was just doing push-ups of all things. So the people at the gym recommended Dr. Drew, and I was like, I don't know. They're like, trust me, just go. I was like, I'll give it a shot.
Fair enough. Right?
It's not like a chiropractor, it's soft tissue. I'm like, I don't even know what soft tissue is.
Yeah.
So went in and you worked on first my neck, which, holy cow, did we make some awesome progress there. Yeah. And then we just kind of worked. I was like, well, since that worked well, I've had this thing on my forearm going on for 10 years, lifting heavy. Hurts my elbow, kind of like tennis elbow. It just was like, man, but it was like to the point where I couldn't even carry my groceries, right?
Yeah.
So, and then we just worked down the rest of my body, and now I'm in maintenance and have so much more mobility than I have even over the last, 10 years. So explain to those that are watching, though, what's the difference? Why is soft tissue so amazing that you're in it, that I love it?
The difference is it's not recognizable care compared to traditional chiropractic. So, when people really say, oh, I thought you were a chiropractor. We still get people all the time who come in and they're like, when are you going to start adjusting me? Mm-hmm. Or how does that get added into the treatment, the soft tissue stuff? Mm-hmm. And it's like, well, my doctorate is in chiropractic, but that's your ticket to entry. Mm-hmm. That's the degree. But I'm a soft tissue specialist, meaning that the whole goal with anyone who ever walks in the door is diagnosis first, which is not the goal of most clinics. And I was having this conversation with a couple other people today too, is in musculoskeletal healthcare, especially conservative care, conservative meaning non-surgical, non-invasive, because it's safer and the side effects of doing treatments are typically not too bad. Mm-hmm. Like you might get sore, or it can make your problem temporarily worse if it wasn't what you needed, but it's not gonna do like this overwhelmingly damaging harm to whatever your problem is. Right. For some reason in musculoskeletal healthcare, we've just gotten away from diagnosis altogether. And it's become treatment focused. It's become, hey, this guy does this type of treatment, I'm gonna go check that out. Mm-hmm. And so people go and they get treatment and they don't have a diagnosis. So they go somewhere and it doesn't matter what you have, because these treatments are for the most part safe. You just end up getting whatever this person knows how to do, not necessarily what you need. And the whole point there is, what's the diagnosis? What's the thing or things causing the problem that you have? And then from there, as an expert, we can choose or select the treatment that you need that's going to fix that specific thing, even if that's a treatment that I don't do.
Right.
So, you know, you go to a chiropractor and they're going to adjust you. It doesn't matter what you have. You could have neck pain for 10 different reasons. Lay down on the table and you're getting an adjustment. So that one size fits all thing rubbed me the wrong way, and has for a long time. Right. So the whole point is, in every other form of medicine or health, we measure it, we diagnose it, and then we make recommendations. Imagine going to a medical doctor and being like, yeah, I've been having chest palpitations, heart palpitations, difficulty breathing, and my feet are swelling, and I'm starting to get shooting pain in my left arm. And imagine if that person goes, well, we've got this new drug in, let's just give that to you and we'll see if it works. You'd be like, yeah, cool, this is the last time I see you. But we get away with that in conservative care, because what happens? You end up, if it doesn't work, you parted with some money, you may still have your problem, it might even be worse, but at the end of the day, that other person's like, oh, well, we tried. So the difference is diagnosis first. We have to know exactly what we're trying to fix. So I basically don't do any manipulation in my practice. I don't think I've adjusted anybody in 4 years. And the reason for that is because nobody's really come in with a problem that warrants that treatment. It's really good for one specific problem that people have that is very, very, very uncommon. But I don't spend any time doing that stuff because, in my opinion, it's based on very old school chiropractic theory and philosophy that's 200 years old that is not relevant. We've evolved. So what we do in here, and what is soft tissue is your muscles, ligaments, tendons, nerves, anything that is not bone in your musculoskeletal system. So soft tissue is muscles primarily, and they attach to the bones and they move your body through space, and they have to be stretchy and they have to contract and be strong, and they're like rubber bands, and they need to be healthy for you to be healthy. So we measure flexibility and then diagnose problems depending on what shows up, and then fix those accordingly. And by fixing your function and diagnosing things accurately, we can actually get to the pain and fix the roots of the pain without having to be like, I'm trying to fix the pain.
Or be able to see very clearly what you're dealing with.
If
it requires something else, a surgery or that sort of thing.
Undoubtedly, Sometimes it's that we don't have a sweet spot for conservative care to work. But that's me doing my job, is by saying, hey, so I could have messed with this 10 years ago. It can't. Your problem is past where conservative care is going to help you. And then the next stop is to see this person who is a surgeon who specializes in this, because that's your best bet. And that's, if that's the case, that doesn't happen all that often, but sometimes we see things really late stage in the game when it's past that point.
What more can you do? Explain, because it was new to me too, what adhesion is.
Adhesion is scar tissue. So adhesion is by far and away the most common problem in the human body, or in the musculoskeletal system at least. And it is collagen fiber type 3 buildups. We've got a whole bunch of different types of collagen in our body. Type 3 is this stuff that is created by our body during periods of overuse primarily, but also through trauma and through repetitive stress. So if you're running down the field and you blow out your hamstring, your body's going to glue that tissue back together with scar tissue. But then that's going to make the hamstring weaker and less flexible, which makes it more susceptible to injury. So adhesion itself is collagen fiber buildup that is easily overlooked, but because it's such a weak density of cartilage, we can manipulate it and reduce it and get rid of it to make the tissue more flexible and stronger, and thus decreasing risk of injury and pain.
Which has been cool to me because, as we're going through this, you working on my body, making progress, and I have had this, we actually start connecting the dots. It's like, oh, you have this thing in your quad, and that oftentimes is, making up for such and such. I was like, oh, I tore my hip flexor in high school, and you're like, oh, that's why your hamstring, this compensates. And it's just been interesting to see, like, oh, this has been an issue that's kind of been a domino effect. And if you, depending on when you catch it, a lot of people don't, they'll wait till they're 50, 60, 70. And it's even worse by then.
And that's the tough part, is the body is inherently complex, very complex, but also the most intelligent design of anything, of any machine that you'll ever see. I mean, there are times where was learning anatomy and I'm looking at these tiny little muscles and I'm like, why is that there? And then you see it work with other muscles and you're like, that's why, and that's brilliant. So
that's pretty cool.
it's pretty amazing stuff, but it's not easy.
Right.
We just grow up in this, or rather now especially exist in this time of instant gratification, where we think, well, I have pain right here, and if I just stick needles in it, then the pain goes away and I'm better.
Right.
It's like, oh, no, it's not that simple. Like, that's where you feel stuff, but there's a lot going on.
Right.
We have to see how it all moves separately and also together. So from complexity, we have these simple parts, and then we basically have to take those simple parts and reverse engineer them back together to see how it functions as a whole.
Right.
So it's like if you take your car in, you've got one thing falling apart on it, and you're like, well, actually this and that and this are responsible for these things, and turns out nobody saw this part, and you got to fix all that. Otherwise, you fix one piece, things just keep falling apart.
Well, it's just like rehabbing a house, an older house. You never know really what you're dealing with until you start taking walls down or the exterior away to see what's really underneath. Yeah. And that's where you start to see, oh, there's wear and tear, or there's no point in just slapping a Band-Aid on it, right?
Yeah, and the body is, and that's especially true with the body. It's at first when I was in school, you get hung up on these, like, you get tunnel vision with certain things. Yeah. You're like, oh, I've adhesion. Adhesion's a big deal. This stuff people have. We all have it to some degree. Everything's adhesion. I'm in school. Everything is adhesion now. I've got to fix it. Everything. Oh, you first start getting into practice, and you're like, oh, yeah, your range of motion is like 10% of what it should be. Yeah, it's just adhesion. You got so much adhesion. You get in there and fix it, and it only goes to 50%. And you're like, what? I didn't go to 100%. Your range of motion is only half what it should be. In my mind, like now, it's like, that's awesome. Your range of motion is half what it should be, but it was 10%, and that's just as good as it gets. Because what's the other thing? The thing that we unlayered. Your body has layers. It's complex, and oftentimes we're getting in there and we're fixing the adhesion in one area and we're unlayering a problem, and something else is kind of showing that that's an issue. The things that can't be fixed and setting expectations is like a whole different conversation or a whole different thing there. But that's equally important, is knowing what you can't fix. Right.
What I love about having come and seen you and been coming to see you for a decent amount of time now is that you're really good at simplifying into layman's terms, so that clients, customers, what are we called?
Patients.
Yeah.
Clients, patients. Yeah. Visitors.
Yeah. Have a good idea of what you're actually doing and what you're talking about. So along those lines, though, what would you say is the most common thing that you're typically addressing? Upper back, lower back.
Yes.
Yes.
Yeah. So
all the above.
Neck, and upper back. Basically, upper back is still neck. And low back. Yeah. So low back pain is, the numbers change year to year, but the last time I was looking at this stuff, low back pain is, the single cause of disability worldwide, and in this country accounts for billions of dollars of lost wages. And over half the people in this country are going to have it at some point, and an even higher percentage of those people are going to have it over and over and over and have it consistently get worse. So low back pain, by far and away, is something that we see all day. And then neck pain, especially with technology now, and the whole we look down a lot stuff. That's right there. So neck pain and low back pain together, 70% of my practice. Yeah.
So is this even possible to give them an idea without actually having them see you do it on a patient? But what does a typical session look like? How are you actually manipulating? Or you said you're not manipulating.
Well, we are manipulating, because if you think about it, what is manipulating? It's you having an authority or a way to tell something else to get something else to change. So we are manipulating the soft tissue because I'm changing the health of it. I'm changing the chemistry in the tissue. I'm deforming it. And I'm able to do that with tension in tissue in pathological areas, so areas that are unhealthy.
Mm-hmm.
So what that would look like is day one would be like an exam, which is what we do,
Mm-hmm.
and we never speed the process up with that. It's like, nope, we need to focus on this to sit down and talk about what could be going on
Mm-hmm.
and measure. And that age-old saying that if you can't measure it, you can't manage it is true for the body, is we measure ranges of motion, flexibility, and strength to see why things aren't working and where the kink in the system is. So we get in there, we see what's going on. I get in there, I check all the tissues and say what could be going on before we even think of treatment.
Mm-hmm.
And sometimes we find stuff that is not musculoskeletal, that is metabolic.
Mm-hmm.
We go get a blood panel on somebody and they've got, celiac disease, and they've got this systemic inflammation thing. Like these things happen.
Mm-hmm.
But we get in there, we diagnose things for whatever they are, and the goal there is to be objective as objective as possible in the clinical setting.
Right.
So it's to say, check your ego at the door. There's no pride. I am a silent observer of what is going on, and I'm not deciding what it is. It's telling me based on what is factual.
Right.
So operating in reality. So we diagnose it, and then a treatment session would be like, we get in there, I'll test that range of motion, see where it starts. For example, ankle dorsiflexion, ankle's got to bend, it's got to be 6 inches from the wall. I just say it's 50% function, really bad.
Yeah.
What's going on in there? Well, you sprained your ankle 20 times and you got a ton of adhesion. Start chipping away at the adhesion with my hands. I do that. That's the manual manipulation in the soft tissue. So it's a hands-on manual therapy treatment. And then once I hit what's called the treatment dose, which is as much as that can handle without being worse, we remeasure it.
Yeah.
And oftentimes by breaking up adhesion, the changes are instantaneous, which we see. You've seen it time and time again, and we see it day in, day out with people. I test it. It's bad. I treat it. It's, that might be uncomfortable or might not be. I retest it. It's better.
Yeah.
You come back in, and it's still better. That's the difference. Is sustainable change.
And it's almost, it's like, going to a regular chiropractor. Again, like I said, I've gone to not a ton, but several, and didn't really ever feel like, I was like, well, okay, drop some coin on that. I hope it works. If anything, I feel more sore the next day. Maybe it helps, maybe it doesn't. I don't know. I'm not ever really convinced. I go get a massage, and I spend an hour or 90 minutes, and I feel better, just to say emotionally, and I feel looser and more relaxed. Okay, what I really like about coming here is, 15 minutes time, I walk in, I walk out, and I can turn my head here, and I can turn my head there, and there's so much less pain. And I do love how it's like, I know that I'm going in, I'm going to have results every time, just from our testing, and then 10 minutes later we test. Dang, because I can see I can only turn my head so far, and then 10 minutes later, after you do your thing, I don't know. To me, it's so satisfying.
Yeah, And that was a difficult thing for me to commit to in the beginning of doing all this stuff. Is my mentor, and when I would go to these seminars and we'd go over all this, it's like, okay, well, did you measure rotation that visit before you started treatment? Like, this is like several years ago. And it would be like, oh, well, I just knew that it was bad, and so I got in there and started treating it, and then I just measured it after. Why didn't you measure it before? Because those tests that we put people through are function, and you can't have a healthy neck unless you could just rotate it 90 degrees to the side, and if you can't, there's a problem. Even if you don't feel anything, there's a problem. So measuring that is not just a way of being objective and saying, this is a double check on did I treat the right stuff, are we on the right track, but also a communication standpoint, because other than what you feel, how else do you know it's working? Right? If you feel better, you're like, oh, I'm glad something finally got rid of my pain, but you don't know you're like had 60 degrees and now have 90. And so it puts that into perspective. And I think that's just communication. Just is as big of a part of this job, and I think any job, as the hands-on treatment side.
Which again, I think that helps just as a patient, because you're crushing through people, not a horrible way, but like you're very efficient in seeing people every 15 minutes. And it's really good to know that when I came in, I was at 65%, and I left and I'm at 85%. You
Yeah.
know, it's like, yeah, it's only 15 minutes. However, you know,
Right.
visit after visit, chipping away at that until the point where you're like, yeah, you've
Right.
sustained 100%. I'm like, that's amazing. You
Right.
know?
Yeah, and there's the stigma with manual therapy is like you just have to go forever, in the sense of like, you know, I know a lot of chiropractors who just do package deals with people, not based on anything other than trying to figure out. I mean, I've got friends that treat people as short money, medium, and long money, and they see them and they're like, I think I could get a package out of this person that would rope them into $5,000 worth of care that leaves them with who knows.
Yeah.
And so the interesting thing there is I don't get to decide what treatment you need. Your tests decide.
Yeah.
Tests determine treatment.
Yeah.
Tests determine discharge. There are people that I have seen that I don't see anymore based on I've measured it and they've held up for a long period of time, to the point where I'm like, look, this is not falling apart. You've been feeling great and doing all the things you love.
Yeah.
I'm going to move this to see me when you need to see me.
Yeah.
If there's anything else that bothers you, let's take a look.
Yeah.
So
It's beautiful.
So that's the piece of it, is there's an end in sight too, because oftentimes people sink into this like infinite abyss of dumping money into healthcare, and the problem with that is, you know, the reason why they do it is because there's no diagnosis.
Yeah.
So
True. And I would say even in the last decade of a lot of the, you know, at least the physical side of things for me, working with people who are losing weight, you know, they're great as long as they're seeing consistent results.
Sure.
You know, if they start to plateau, then it always becomes the question of like, why am I spending this money?
right.
So
Totally.
I think that's just human nature. But I think that's really cool. What do you feel like is then the most fulfilling part of your work?
Yeah, I was talking with Quinn about that earlier today.
Yeah.
And hands down, it's the person who's had their problem for 6 months or more, who's seen 3 or more providers with little to no results and possibly their problems worse. And basically they're in a dark place. They're in a real dark place. They got a glaze in their eyes. They are a shell of what they used to be. And what I do for a living is not life and death, but it's lifestyle.
Yeah.
It's quality of life.
Yeah.
And there are times that I would argue, and some of the people that come in here would probably argue, when you have pain, you live in a constant state of pain for years, and you can't pick up your kids, you can't throw a ball around with your son, you can't do any of the activities you like to do. You have to take time off of work. You can't go vacation the way you're supposed to. Your personal relationships are hit. When you hit that point in your life, and then you show up and you're basically at wit's end and you're like, look, I'm whatever, like if any relief would be good, and then to have your problem full on be changed, that's the only reason why.
Sweet.
So that's the whole point, is to say that results, you can find results, and there are people out there that are trying for that nonstop and aren't just going through the motions. So seeing that, and you know, we see that all the time, but we also see a lot of people who just have new injuries, never had pain before, and fix them in 4 visits, and then they're out the door, and they're like, cool, well, that's what I paid you for. Good stuff, see ya. And you're like, yeah, this didn't affect your life.
Right.
So oftentimes it has to just have that emotional root. And then when we get it moving, like that thing where it's like, make no mistake, you've changed my life. And I'm like, well, we've definitely changed a lot of stuff. And they're like, no, I don't think like that my life was bad, and now it's good. So those are the fun cases where and those are oftentimes the most difficult ones. But that's why, hands down, there is to do a job. A lot of people hate their job, and to be able to do a job that you do like, that does provide value to others, and to be paid for it, that's the dream.
So I mean, I think, I'm in my 30s, but you know, I've taken enough wear and tear just through sports and living an active lifestyle that I was already, it just makes you start feeling like you're older than you really are. You know, my dad just went through a hip replacement, and it's like, when you start losing your mobility, it's a scary thing. You know, when you start getting it back, it's an exciting thing. For me, I had stopped lifting in certain ways. started slowing me down there with my leg. I'd kind of stopped. I wasn't able to really even run around the lake that far, because my soleus, my Achilles, my calf, and to be able to go, I remember, just running that 2.5 miles around, and then, or jumping around in the gym and not having that pain because you broke up so much that I was like,
it's pretty wild.
Yeah, because you start to just assume that this is how it's gonna always be.
Yeah,
this is just wear and tear.
Yep.
I'm just getting older, and that's kind of BS. It takes maybe more effort and more work to keep in health as you get older, but it's certainly
without a doubt,
possible.
And pain and injury are not artifacts of growing old.
Yeah.
So we have a tendency to think like, oh, I'm just old. I used to be so much more flexible. Well, you probably have some stuff going on there.
Yeah.
So,
yeah.
But yeah, it's pretty wild, and we get that a lot too, where people are like, yeah, I didn't realize that I couldn't do those things until I didn't feel like I had any restrictions on doing those things, and I went and did it, and I feel like pretty good when I'm doing it.
Yeah.
It's like, wow. Yeah. Turns out I just thought that was normal because I'd just been bad for so long.
Yeah,
it's pretty wild.
And I remember telling you, like, every morning I'd I'd be getting something out of the cupboard, making breakfast, and I would reach and I'd turn my head and there'd be a point where something kind of like caught, and I'd be like, it's a very vulnerable feeling, right?
Yep.
Whether it's a nerve or it's your spine or whatever, something gets caught and I'd have to like roll my shoulders back and like, I hope, because the thought is like, shoot, if this sticks and I can't move, like,
my day has changed.
My life has changed, right? And to have that disappear, I mean, I've been doing that almost every morning for 10 years.
Yeah.
And since seeing you over this last year, I haven't had that.
It's awesome.
So many different things. That's so great, So it is quality of life.
Yep.
And that's my whole shtick is like, quality of life is, yes, your physical body first and foremost.
Yep.
Secondarily, it's like, what are you passionate about that you are here on this planet for? And then thirdly, how do you get to show up as that person, hopefully, in your relationships?
Yeah.
With your significant other, your friends and family, your kids, that sort of thing. And I think, if you start to lose this, which is, like you said, such an amazing adaptive machine, then what do you have?
Right. And I like to say to that, to your point, I say that to people, especially in any line of like service industry, I guess in anything, we kind of hit this thing where you're like, well, I also want to save money. Mm-hmm. And so you see a lot of people that are like, oh, well, your care is too expensive. And it's just like, well, let's be honest. It's not that expensive. You don't see the value in it. Mm-hmm. So you don't want to pay for it. And, a friend of mine had said, I just tells people directly, it's very blunt. It's just like, make time for health, mm-hmm. or make time for injury.
Yeah.
You choose.
Yeah. Because
if right now you can get this taken care of before it's a big problem, otherwise you can see the surgeon in 10 years and it's not going to help you. Mm-hmm. And that's 10 times the price. Yeah. So it's just one of those things where, people work to make money and we need it to survive and all of that stuff, but it's really hard when you lose health to get it back.
Yeah.
So like if you're making all of this money and spending all this time and destroying your body just to have to spend all of your money trying to get your health back, what's it for?
Right.
And if you can't, a lot of times when you lose health you can't get it back, but you can make more money. Mm-hmm. So where's that disconnect, or where's that trade-off?
Right.
Like there's nothing more valuable to yourself than your health.
Right.
Long term.
Right.
The only thing that has to last is you.
Right.
So it's just it's interesting because sometimes people come in with that mindset, and other times they're like, yeah, well, what? Like, I want this problem gone yesterday. I don't want to have to pay for it, and this is your problem, not mine.
Yeah.
It's like, okay.
Yeah. Yeah. Good luck.
Yeah.
Good luck to you on that one.
Mm-hmm.
Here's a good question. Would you say a lot of the reason why you got into this work is just so that you could wear the same thing every day?
I've been fighting for that for a long time. Yeah. Yeah. And I wanted it to be pajamas, but this is close.
A onesie.
Yeah.
Yeah.
I missed the boat I really missed the boat on the whole work from home thing.
Yeah.
And I didn't even realize when I was in school that was ever going to be a thing.
Yeah.
But I mean, to be able to just be in a Harry Potter onesie and to be able to conduct business like on a high level,
right,
and just be done, and then just go eat Fruity Pebbles or something.
I don't know why you couldn't necessarily do that. I mean, to think that people just come to your door, to your house, and you just open your door in your onesie, and then you get to, adjust their necks and stuff like that.
Yeah, no,
that's not creepy at all.
No, it sounds like a really busy practice. Sounds like a lot of people would show up and trust me with their help.
Yeah, absolutely.
Yeah. No,
this is very slimming though. It's a good color on you.
I purposely selected the color palette for
today.
I'm just a floating head that's blends into the chair. No, I used to dress up for work. It was just non-functional, and it got to a point where the people that I was treating, they were just like, "Why are you wearing this? It doesn't make sense for you.
Yeah.
You're wearing like a shirt and a tie and slacks, and you're over here like pulling people's legs while and you're sweating, and your tie is dangling in my face. What's going on?" So then I just got away from that and realized that just does not make sense. So scrubs it is.
Right. Well, and of all places, Denver, we're pretty darn casual.
Yeah.
You don't see a whole lot of suits and ties, to be honest. Not like the East Coast.
Oh, really?
But and there's good and bad to that. But I think with the work that you do, and I mean you're moving around and all that stuff, I think it makes perfect sense.
Yeah.
And I say it as a joke, but yet at the same time, it's something that you probably take into some thought, and it's kind of switching gears into more of you having built your practice and your business. What would you say is kind of the area that you're most excited about to grow or to streamline or to improve?
Yeah, it's interesting. It's not one thing, because if it was one thing, then it would leave space to have like holes in my game somewhere else, I think. So I think it's communication with people can always be better.
Right.
Because people come in and you deal with 20 different people with 20 different personalities, 20 different emotions that day, 20 different sets of circumstances. And to be able to adapt and be able to hear what they're saying and empathize with them and get through to them in a restricted amount of time, like that's an art. So always getting better at that, getting better at treatment. There's always room to be better at your craft. No one achieves mastery, you just pursue it. So that, and other than that, I just think that maybe expanding the size of the practice would be cool and a new challenge, because it's one thing having to fix someone's problem, but then also to have to like run an efficient business. It's not for everyone.
Right,
so
right.
Business is completely different from the healthcare side of it.
Right. Well, and I feel like I've dealt with for a long time working with men and women with their physical health, and yet it's a lot of times the byproduct, their health or lack thereof, is a byproduct of the stress in their life, their relationships, their work. But then they decide to have a child or two or five, and that's almost like running the business of your family. Yeah. And so it's a challenge, and a lot of things, it's almost like spinning plates. You got to keep one moving and got to spin another one. Oh, yeah. So how do you balance between running a successful practice with the rest of your personal life and your own health? And because that's a challenge that I take on as well. That we all do as entrepreneurs. But how do you deal with it? Or what do you feel like is?
I think that the toughest thing to do is to own your own business and to be able to step away and be okay with it.
In what way though? In trusting that it's not going to all fall down?
Yeah, and just I was never meant to be in a corporate setting. Like I don't have the type of personality to handle other people telling me what to do. But also like I was never going to be in a situation in which I got comfortable enough with like a salary that somebody was just paying me to do a job. It just didn't make sense to me. It didn't fit. I didn't really even seek that. So I think the issue is when you own a business and you have a hand in the development of it, you think that all of your attention needs to be focused there, and that more is better. And so that was especially tough in startup mode when you're like, all my attention goes to this, and something's going to suffer. Right. Like no personal relationships can sustain that when you are, focused on one thing. So in the beginning, it was set expectations with the people in my personal life and just be like, hey, this is going to require like just an increased level of time
Yeah.
to get it off the ground.
Right.
And then after that, it's going to require that we maintain certain things and do certain things, etc. But I balance it out by now structuring everything.
Mm-hmm.
As much consistency as I possibly can. And I don't mean that by routine, I mean it by being consistent, like with the days. Like, yeah, I do try to wake up at the same time for the most part every day,
Yep.
even though I don't treat people at the same time every day.
Right.
And I try to work out at the same times generally, and all of that. But it's mostly because when it comes to the work stuff, I know that if I do too much of it, focus too much on things, that it affects my personal life. And sometimes I'm working on stuff that you're working on stuff that can wait.
Yeah.
You think that staring at a computer for an extra 3 hours actually provided more value, but you burnt through 3 hours, you're even more tired, and you don't have any energy for
Right.
someone at home who's really wants to hear about your day.
Yeah.
So scheduling things and being like, all right, there's a never-ending list of things to do. I'm okay with that. That's being a business owner or being and having an entrepreneurial spirit.
Right.
Is I've done 3 things and I've now added 4 things back onto a list. Fair enough. Get comfortable with that. Live in that, and be super, super happy with what you do get done, and reward yourself by doing less.
Right.
So I just try to take time away.
Yeah.
And just go do other things.
I think that's hugely important for your own sanity and
Yeah.
mental health.
Because even if you love something and you have the best job in the world, too much of anything is just, you'll get burnt out.
It gets boring too.
We're all human.
Yeah. Absolutely.
So that's the name of the game, is trying to free up time specifically.
Yeah. Well, I know, and you've told me that you regularly, quarterly, or even more often that sometimes invest in continuing education and masterminds and things like that. Do you have any? What are some of your practices that you do to kind of keep new thoughts coming in? Do you have a mentor that you look up to, that you work with? Do you listen to podcasts? Do you read books?
Yeah.
Like all the above, or what do you find that helps you kind of keep you sharp?
Yeah. So for a long time, for many years, especially right out of school, my mentor had a coaching program in which you would Skype chat with him twice a month.
Yeah.
And I do that. My business partner does that. And so that was a way to say, oh, I'm going over a difficult case, or I have these things regarding communication that I'm not sure why I'm not getting through to this person. We walk through that case, and it keeps you accountable. Mm-hmm. And then I'm harder on myself than anyone would ever be on me. So I have this little tablet that I keep notes on for the day. Mm-hmm. If I had a conversation that was tough with a patient or whatever that was, keep notes on it, and I go over it and I look at it with a fresh head. I table it and I go over it later and decide why was that.
Yeah.
So I review that stuff daily. Also, I've got all types of notes on old coaching things that I had done, that I review to make sure that I'm not developing any new bad habits or anything like that.
Right.
I do like to read books. I don't do as much of it as I want to. I like to watch a lot of movies and see what other people are creating.
Mm-hmm. Keep you inspired.
Yeah. And then other than that, I do a ton of continuing education, and my business partner, we keep each other accountable. So we treat each other and we break each other down, as far as just in the sense of like the touch and stuff like that, because he knows what that's supposed to feel like when I'm doing the treatment.
Right.
And I know what it's supposed to feel like. And was that the perfect treatment path? What could be improved? Mm-hmm. So just that thing pushing towards mastery, and then we all decide on days and times to go fly and leave Denver to go train with our mentor and do one-on-one or small group hands-on trainings to keep us dialed in and make sure that we're still continuing in the right way. So there's a lot of things there. What I could add to that is more scheduled vacation time.
Yeah.
Like, not because I need it, but just because it's good to do.
Mm-hmm.
And for personal relationships, and just for the fact of like, just be like, I'm done with no social media for a week and stuff like that. Just to get get into it. But yeah, the arts are things that I want to like go. I used to do that stuff all the time, and then I started doing it less. But I really liked it. Things to just kind of go a little bit more artsy.
Yeah, same. Just kind of a different part of your brain.
Yeah.
Being,
workshops and stuff. There's a lot of cool stuff going on in Denver like that, where you can sign up for. This is how you can make your own coat rack, and you get to work the wood, and you just pay for it. Or they've got all different types of things like that. You just get to sign up. It's fun things to do as a group, and just keeps you moving and engaged in a capacity that is not just what you do all day. I want to learn Spanish.
Right. A question or two more. How are you finding, that your business continues to grow? How are you doing your marketing? Is it word of mouth? Is it social? Is it all the above, of course? But what do you feel like has been most effective?
Omni-channel approach. It's got to be all things, and then you just figure out what seems to work the best and kind of double down there, and then things that don't work, you try to fine tune it and figure out why and see if it's of value or not. So for us, in this line of work, we do many different things. So, in order for people have to know you exist. It's more difficult than ever for that to be the case. So, you gotta do the stuff online. So we do a ton of paid ads and sponsored ads and stuff like that on Facebook and Instagram that are just recurring. We get in there, we look at the numbers, we say, why didn't this reach people, or why this reached people a lot, and we fine tune all those things month after month and just keep it going. So it's just an investment right back into the business. In addition to that, we do hands-on events. Some things are like teaching events where we're teaching people how to, basically do self-testing, just to say, oh, this is a runner's workshop, this is good runner's mechanics, and we'll go over certain things. Other times we do events called Ask the Docs, which is like ask the doctor, pain and injury assessment, 15 minutes, chat with me briefly about what you got going on. I'll get in there and check some stuff, we'll see what could be going on and go from there. We do a lot of running races. So event marketing, essentially. Social media marketing. And then other than that, like just awareness stuff. Being in places, wearing your logo, meeting people, chatting. And that's really what I want to do. Is moving forward is the biggest thing. Is meeting people, no expectations, not talking about you, talking about them, and doing networking with people just by meeting people and just meeting as many people as you can meet and growing personal relationships.
Right. Well, thankfully, due to the internet and things like that there'll be a lot of people that see this that don't live in Denver. What would be if they're saying, oh, this sounds great, how would they go about potentially finding something comparable to you, or saying, I like that methodology? Is it as simple as just Googling soft tissue? Like, what's the way? I got referred to you, which is great. Otherwise, I don't know how I would have necessarily found you otherwise, or even known to find you. Because I kind of had written off chiropractic somewhat. So any suggestions or any thoughts?
So if you Googled soft tissue, you'll find all types of interesting feedback. I would say, so integrative diagnosis is the name of the diagnostic system that I use to be able to diagnose and effectively treat stuff. So going to integrativediagnosis.com, there's a section in there where you can search for a provider, and there you just plug and play, where do you live, see if there's anybody near you, and then if there's not, fly to Denver.
Exactly.
That's how that works.
Which my little sister does. Now that she's lives out of town, whenever she comes through, she gets treated by you, but then you also helped her find someone where she lives, and she's been getting good. Which is kind of cool that you were able to have that humility to kind of pass her off, but put her in good hands, literally and figuratively speaking, and she's making such great progress. So
pumped about it.
It's really cool. Last question would be kind of, where do you see, 3-5 years, your vision? Where do you see things going so that you stay hungry, you stay fulfilled, Not necessarily, doesn't, like you said, doesn't have to necessarily be growing bigger, but how do you stay, if this is your career, just passionate and excited about it every day?
I think it comes down to growing the clinic, not just in like with people that come in, but I mean growing, maybe hiring a couple docs and training them, and taking on that responsibility or that new opportunity of being someone who is not just a boss, but also like helping them get skills better, and then those skills translate to being in here and those people working and enjoying their job, etc. And maybe, I don't know, I would like to grow it into having a couple docs, maybe more, and start doing a bit more of the travel stuff, and have the scheduled days that I treat, but then being more of like a clinic director role, where you're really kind of observing operations. You're still treating people, but you're also making sure that everything is going as planned, and you're making sure that you're answering all the questions and all that stuff with like the new docs and stuff like that, and have it be more of like a self-sustaining thing. As far as business stuff goes, that's about it. I don't have any outrageous aspirations for personal life stuff. I don't know if I don't think it's too much asked, to have a family, start a family, and do that whole thing, and have a house and live in it and live a good life and watch your little ones grow up and being able to provide and do all that. Right. So that's a piece of it too. But I don't have any wild aspirations to like have 25 clinics and franchise and all that stuff. That's not a necessity.
Yeah, I mean, when you really do, we go back to that conversation of lifestyle, quality of lifestyle. What does that look like for each and every single person is always going to be different.
Yeah.
Right. And that's you kind of mentioned it earlier as the art of fulfillment, while there being the science of achievement. There's could be a science to building out 25 locations and all that stuff, and be completely unfulfilled at the end of it. Yeah. Right. So I think it's cool that you have a kind of a good idea of it doesn't need to be all that complex. It can be pretty simple.
Yeah, startup is rough. Yeah. Especially if you do it over and over and over again.
Right.
I did it in California, and then I did it again here, and it's like, I don't know how much more I want to build something from zero. Yeah. It's just it's
exhausting.
Yeah. Yeah. I like the feeling of building it from zero, having it grow, and then being like, would you look at that?
Yeah. Yeah.
Built it.
And see how where you can go on vacation, have it keep chugging away.
Yeah.
Yeah. Yeah. Well, thank you for taking the time. Thanks for sharing with everyone that's
absolutely, man,
watching. It's so good to connect and to just dig into more how you've had such an impact on my life, my family's, my sister, my family, friends that I've referred to you as. It's really cool work that you're doing, and I'm so grateful because it does give back the quality, the juice. Otherwise it's it's crappy if you start to lose your ability to function through life. So
without a doubt, I appreciate you coming by. This is fun stuff. Always appreciate it.
Check out my other videos on my YouTube channel. Please feel free to subscribe below, and we'll see you next time.